An ortho gamer. I want to discuss with you a case, and I will just go to the main point which I want you to get from these patients. I just leave these slides and go to the main topic. Here you see how I will analyze my cases. I will check all the proportions, midlines, asymmetries, upper and lower midline, canine asymmetry. I'll check for buccal corridor, smile line, any can't, and the main point which I want you to get from this case analysis is a profile view. The patient is a mild skeletal class 2 patient with maxillary well position and dental class 2, div 2 or division 2. The main point in this case which I want you to see is the profile and the lip length, upper lip length and thickness. The upper lip is thin and lengthy. The length is increased. As you see, the nasolabial angle is 115, which is more than average. And here I did, with help of the simulation, AI simulation, if we change the lip position, thickness and the length, we'll get better appearance. If you see in your screen, in the right one, which I simulated with AI, I decreased the nasolabial angle and increased the lip thickness and shortened the lip length. So in these kind of cases, we have to be very careful with extraction and retraction of the incisors and anterior teeth. So I decided upon to these photos to not go for extraction, and I want to change the inclination of the incisors. I want to procline it more and resolve the class 2 and get a class 1 canine relation, but with more proclination of the anterior teeth and give more supports to the upper lip. But the main point is here, which I like to share with you, and I have an article which I will share with you guys, which you can see and read. In many textbooks, lecture and all, they will talk about nasolabial angle and proclination of the lips according to the E line, Steiner line, Burston line, but I never seen anyone talk about the lip length and retraction. In case of retraction, the lip length will increase more. So if the patient already has a long upper lip and we go for the extraction or retraction of the anterior teeth, the lip length will be more increased. And the appearance, especially for females, it will be very unsightly to see. And it's not pleasant to see the lips which is too long, too retruded. As we see, after simulation, the length is decreased. Not only the proclination of the lips in respect to the E line or Steiner line, but the length also, as you see in this simulation, the length also is decreased. That means in case we do extraction and retraction of the anterior teeth, we are not only making the lip looking more flat, but we are increasing the length. And in thin lips, this characteristic will be more visible for everyone. So we have to be careful. This is also simulation, which we can see how a patient will looks better and younger with pronounced lip, and we have to be careful. So here is an article, which is I found it very interesting article. This is the title, and the conclusion here is I will read it for you. The both cephalometric and photographic evaluation of nasolabial angle were similar. The soft tissue parameters show significant change after the orthodontic treatment. The repositioning of upper lip was more acute when the lip thickness decreased. But we are not only considering the thickness of the lip, but we have to consider the length of the lip also. Once you go for distalization or retraction of the upper anterior teeth, you are not just loosening the lip fullness and proclination, but you will lengthening the lips, which in these kind of cases, it's a red flag. You have to be very, very, very careful. As you see here, the thin lip, high resting tension, this is the characteristic of the thin lip, low soft tissue volume, strong dependence on incisors. So if we go for large lip retraction, follow the incisor, nasolabial angle will increase, and risk over the retraction, it will cause profile flattening and excessive nasolabial angle and increasing the upper lip length. But in thicker lip, we are more safe. We are more safe. If we have a thick lip, we are more safe because the change will be small and safe for the extraction. So we have to be careful not only about the thickness and nasolabial angle, but the length of the upper lip. So hopefully this was useful for you guys, and see you again. For this case, I decided to not go for extraction. I decided to just solve the class 2 case with help of IZC screws, and I will share with you guys the result. Take care and have a good weekend, the last moment of the weekend. Enjoy it. Bye bye, and see you next time.